Health news now and some troubling news tonight about prostate cancer.
There has been an alarming spike in the number of men diagnosed with an advanced or incurable form of this disease. CBS 2's Dr. Max Gomez is here now to tell us what doctors think may be causing this rise. Dr. Max?
That's right, Christine. The vast majority of the 180,000 prostate cancer cases that will be diagnosed this year will rarely become an issue for the patient. But there will still be more than 26,000 deaths from prostate cancer this year. It's those metastatic cancers that have jumped and have doctors concerned. Frank Ehrlich, like many men his age, has been keeping an eye on his PSA levels as a possible early warning sign of prostate cancer.
I had a normal level of PSA of 0.5 for many, many years. But by February, it went up to 3 or 4.
That's still low enough that Frank had a number of treatment options. But 4 years ago, a federal panel advised against routine use of the PSA blood test to screen for prostate cancer. Now, a new study in the journal Prostate Cancer and Prostatic Diseases finds that new cases of metastatic prostate cancer climbed 72% in the past decade and almost doubled in younger men ages 55 to 69.
Well, metastatic disease means cancer that has spread beyond the prostate.
Then at that point, it's not considered curable.
That's correct.
But the upward trend in advanced prostate cancer started before the new recommendations, and this cancer is very slow growing, so the effect of those guidelines likely won't be seen for a few more years. The other theory is that prostate cancer itself is changing.
Whereas it used to be a little less of an aggressive disease, over the time it's become worse.
What concerns many urologists is that the biggest spike in advanced prostate cancer was seen in the age group where early detection with a PSA test could lead to curative treatment. And that's why Dr. Badani and others say men should have a frank conversation with their doctors about PSA screening, because the test can also lead to a lot of unnecessary biopsies, and that comes with costs and infection risks. So for some men it's important, for others it may not be quite as important, all on an individual basis.
Good information, doctor. Thank you.
Thank you.